We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we give you the latest trending medical headlines and celebrity health news. And hey, it's February, and we're not going to disappoint. It's Black History Month. It's Heart Health Month. So we're going to have us a good old educational month. Let's start off talking about Ray J. Do y'all have love for Ray J? We talked about how he was hospitalized recently with pneumonia, and he complained of chest pains at that time. Well, now he has shared that he was told that his heart was beating at 25%, which sounds like he had heart function of 25%, perhaps something called an ejection fraction. And so I'll talk about Ray J and the likely heart condition he has, what you need to know, how to prevent it, what to do about it. And then we will keep on moving into other news, something called the Nipah virus. There is a bat virus, some are calling it, and it can cause a big problem because it kills up to 75% of the people it infects. Yes, there have been cases in India. Southeast Asia is on full alert. And again, it's a very, very fatal virus if you get it. And so I'll let you know what you need to know about the Nipah virus, what to look out for, signs and symptoms, how to prevent it, because there's really no treatment. Then we'll get into my favorite game, myth versus fact. Did you know that 90% of Americans have silent heart disease, as in they don't even know it? Well, there's a new syndrome, CKM, that you definitely need to know about. We'll talk about that through a little game, myth versus fact. And then I'll get into giving you more trending health topics you simply can't get anywhere else, not with the spin that we give it. We are going to talk about the Blind Side star. You remember him, Quinton Aaron? Well, he's been having some serious health complications. He's been hospitalized, he's in the ICU, and he had something rare called a spinal stroke. Are you at risk for a spinal stroke? Let's talk about it. And lastly, we will talk about kidney disease. You know, I'm a board certified kidney doctor, and Octavia Spencer and Sofía Vergara are teaming up and talking to us about how to prevent kidney disease. And so we'll talk about some of the screening tools, some of the early warning signs, and what you need to know to keep your kidneys healthy. And of course, we are live. And so I'm going to ask you questions, and you can ask me questions. We can ask each other. I'm Dr. Frita. Go ahead and give us a like and a subscribe. This is Dr. Frita Live. Welcome, welcome. I'm Dr. Frita. This is Dr. Frita Live. Let's get into these latest trending medical headlines and celebrity health news. You know I'm not doing it all by my lonesome. I'd like to welcome my co-host and my office manager, Miss Shador, to the stage. How you doing, Shador?
Hey, good, Dr. Frita. How are you doing?
Doing well, doing well. Did y'all get any snow this weekend?
We got a little dusting, I guess. It's just a little bit. How about you?
Well, yeah, we got some. Nothing stuck too much, but I sure stayed locked up in the house and was glad to do it. So it was a pretty nice low key weekend for the most part.
Mm-hmm.
Yeah. All right. So who is the first person in the chat today?
Yes, ma'am. First in the chat today is Miss Marina. Good
Hi,
Monday morning, Dr. Frita.
Good morning. All right, get your pencils out. You know I'm going to be asking you questions all throughout, and especially in myth versus fact. Welcome.
Absolutely. And Dr. Frita, we do have some new members that's joined us today. We will get to them. Shout out to Brown _ Butterfly.
Welcome to the membership.
Ms. Ella Anderson.
Hi, thank you for joining. Welcome.
And Latrina Whitaker.
Hey, we got some nice little new members. I appreciate you so much. So let me tell you. So at all levels, I appreciate you, and we definitely give you special shout outs, special emojis. But then if you join at the resident level, then you'll get a chance to see my members only videos, where if I do, for example, a video for everyone else, then oftentimes I'll go and give the members the extended version with even more medical information. And sometimes I give you a little behind the scenes of when I'm on different shows, different national news shows and things of that nature. And then if you join at the highest tier, then you will be a part of our monthly live Q&A. That's when we meet and you can ask me whatever questions throughout the time period. You can even come up on stage and we can talk that way. And so instead of me just talking, y'all know I love to talk. I'm more listening and I'm answering your questions. And so if you have questions about doctor's appointments, about second opinions, and you don't mind other members hearing, then you get it right there, one-on-one or one-on mucho. But either way, you get some special attention. And so I definitely appreciate you. And for everyone else to join the membership, please click the link in my description. Or of course, you can always go to my one-stop shop, drfrita.com. Oh, and for those of you who are new to us, I am Dr. Frita. I'm an MD. I'm a medical doctor. I have been quadruple board certified. I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure. And I have also been board certified in internal medicine, pediatrics, and obesity medicine. And so I like to talk about a lot, but more importantly, I love to share that information in a way that's easier for you to understand. So we're here, of course, every Monday. I have hundreds of videos right here on YouTube where we have over 950,000 subscribers. It might be over 953. I don't know. We're jumping, we're growing, and I appreciate you for that. But we're definitely trying to march toward 1 million. So if you haven't already, please give us a like and give us a subscribe. And if you actually do want to talk to me one-on-one, like literally one-on-one, I offer a telehealth concierge service. Yes, I do, where I can help you from anywhere in the world. Just click the link in the description. I'll do a history and we'll talk. You can get a second opinion, a first opinion. And, we're having a really good time. I'm really talking to people from all over the world. And so it's an excellent way to connect and share evidence-based information about your personal health. All right. Well, let's get rolling, shall we? Let's open up, start talking about Ray J. Now, y'all know, years ago, when we first met Ray J, we knew him as Brandy's little brother, but very quickly we saw that he was his own person. He's a rapper, he's a singer, he's an actor, he's a business mogul, he's a reality star person, and he was admitted to the hospital with pneumonia and what he described as chest pains at the time. Well, now he's coming and he shared a follow-up since he's been discharged from the hospital, and he was told that his heart was beating at 25%, which sounds like he means, or he's expressing, that he has an ejection fraction of 25%, which is consistent with congestive heart failure. Let's play the clip and let's talk more about Ray J.
On like 4 or 5 bottles a day, 10 Addies. Fuck my heart up on the right side right here. It's like black. It's like done. Niggas bringing me coconut water and telling me I gotta go to Haiti and do some voodoo, which I think I'm going to Haiti because I think Haiti and my Haitian niggas they got the cure. So I'm going to Haiti like in like 2 weeks, and I'm gonna stream it. I'm gonna do everything, but I fucked up. Like, you know why? Because I thought I was a bigger nigga. Like I had more weight. I thought I was a big nigga. So I'm like, I can handle all the alcohol. Like I handle all the Adderall. Like, I don't like.
Okay, we know Ray J has colorful language, but I really thought it was important for you to hear in his own words what he's expressing. And so it does sound like what he's expressing is congestive heart failure. And we know he's pretty young. He's only 44 years old. But if you listen to his message, he's really giving some key pearls. So what I want you to do, med heads, is I want you to put a heart emoji in the chat and answer this question. What do you think some of the warning signs and symptoms of congestive heart failure are? What are some warning signs and symptoms of congestive heart failure, CHF? So when it comes to Ray J saying that his heart is beating at 25%, he's probably talking about his ejection fraction being 25%. The ejection fraction describes the percentage of blood that your heart chamber pumps out with each beat, specifically your left ventricle. That's that chamber of the heart that's responsible for pumping the blood to your aorta, which is your body's largest artery. And that aorta really helps to get the blood to your other organs. And so it's important that your heart has a proper ejection fraction, so you can get the proper percentage of blood out to your body, because that's what gives you your proper blood flow, your oxygenation. Now, if your ejection fraction is not strong enough, if it's a small ejection fraction, then you're not getting the proper forward flow that you need, the proper blood flow, and you get a backup of fluid. Okay, the system backs up, so you get a backup of fluid in your lungs, in your legs, in your ankles, and it can lead to you having all kinds of issues. Now, so Ray J describes what sounds like the ejection fraction is 25%. A normal ejection fraction ranges anywhere from 50 to 70%. So you can see that if indeed he has that low ejection fraction, then that's quite significant, and it's consistent with congestive heart failure, meaning the heart is not pumping quite as strongly or effectively as it should. Now, if you listen carefully, he talks about all the alcohol he would drink, doing Addies. I'm assuming that's Adderall. And and if he did any other substance, then certainly these could be risk factors for congestive heart failure. Alcohol, definitely. If you drink excessive alcohol, you can get something called a dilated cardiomyopathy. And that's when the heart muscles stretch out and the heart becomes floppy in a sense, and it's just not contracting the way that it should. And it can cause you not to pump blood the way that you should. It can cause you to have a low ejection fraction, among other issues. So definitely excessive alcohol can do it. And Ray J's been sharing in his lives that there are times he could just go through bottles. So, at a time. And then he shared Adderall, but if ever, and I don't know if Ray J has, but let's just talk about in general, certain drugs that cause heart vessel tightness, like cocaine, can also increase your risk for congestive heart failure. They can increase your risk for high blood pressure. And so high blood pressure is another risk factor for congestive heart failure. If you have blocked heart arteries or coronary artery disease, like if you have high cholesterol and you get cholesterol plaques in these heart arteries and then platelets attached to it and calcium, and you get blockage and you have coronary artery disease, that's a huge risk factor for congestive heart failure or having a low ejection fraction. Having diabetes is a risk factor. Being a person living with obesity is a risk factor. Certain chemotherapies, like certain treatments for breast cancer, for example, something called doxorubicin or adriamycin, can cause you to have a cardiomyopathy, which can lead to your heart not beating as well as it should, and you get congestive heart failure. What else? Infections can do it. Things that can cause myocarditis, such as Coxsackie virus, even C19, that virus can cause you to have a myocarditis, which could lead to a congestive heart failure. And even the pneumonia that Ray J had, if you have all types of inflammation in the lungs or high pressure in your lungs, even that can cause you to have an issue with the way that your heart pumps. So there are all kinds of risk factors. What I really want you all to do is make sure that you consult with your doctors and you make sure that you know about your heart health. Now, it's time to play. Let's go, med heads. I asked you to put a heart emoji, if you would be so kind, and tell me what you think some warning signs, warning symptoms of congestive heart failure might be. And remember, symptoms are what you feel, signs are what you see. What are warning signs and symptoms of CHF, congestive heart failure?
Yep, Dr. Frita, they're busy in the chat today, so we have a lot of suggestions here.
Okay.
We'll start with Yada D. Says overconsumption signals.
Overconsumption signals. So what are some of the overconsumption signals? So that's what I'm asking you. What are some of the things that are signaling
All right.
heart failure?
Sandra says poor circulation.
Poor circulation. Okay, so if you have peripheral vascular disease, then that certainly can give you a poor circulation. Blanketly, that's not one of the classic warning signs and symptoms that I'm looking for, though.
All right. Burn.
Yeah, so typically, and you might be describing what I'm talking about, but typically when someone says poor circulation, they're talking about peripheral artery disease, like maybe some blockage in your arteries, and so you don't get good circulation to your feet, your ankles, your legs, or even if you have some type of a venous disease where the blood flow is not returning to the heart properly, and you get a swelling, which could be a sign. But what else do we have?
Burn.
Hi, Burn.
Burn says shortness of breath or swelling extremities.
Come on to the front of the class. Absolutely. Those are classic. So as I mentioned, if your heart is not pumping enough fluid and you only have something like a 25% ejection fraction instead of a 55%, you can get a backup of fluid. Where does that fluid back up to? It can back up in your lungs, causing fluid in the lungs or pulmonary edema. And it can definitely lead to shortness of breath. Same thing, that backup can lead to a backup of fluid in your legs. You can get a swelling in your feet, your ankles, your legs. Those are absolutely some warning signs and symptoms of congestive heart failure. Very good.
Angela on Facebook. Hello.
Hi, Angela. Hey, welcome on Facebook. Oh, y'all did some posts for y'all. I posted something on the bat virus. I posted something for Black History Month. Yes. So hi, welcome from Facebook.
Angela says high blood pressure.
So, that's actually good because it's what came first, the chicken or the egg. Oh, you almost got me, Angela. High blood pressure is a risk that can lead you to having congestive heart failure. But if you have congestive heart failure and then you get a backup of fluid and you have excess fluid in your vessels that are causing the vessels to be pushed out, all that water that's backed up, then it can actually lead to worsening high blood pressure. So yes, what came first, the chicken or the egg? High blood pressure can lead to congestive heart failure. Congestive heart failure can lead to excess fluid, which can lead to worsening high blood pressure. That's good.
All right. Dexter also on Facebook have a few.
Oh, hi, Dexter. What you got?
Dexter says fatigue, brain fog, sluggishness, poor low energy, difficulty of breathing.
Absolutely. Every last one. You come on up here to the front, Dexter. So definitely just in general, you can get fatigue. Why? Because your heart is not pumping efficiently and your heart pumps your blood, right? And your blood carries your red blood cells. Well, what do the red blood cells carry? Your red blood cells are these little soft donut shaped cells, and they carry your oxygen. Okay. They're like the little cars that carry your oxygen. If your heart is not pumping and you're not getting all those red blood cells to your vital organs, then you're not having proper oxygen and you will feel fatigued, sluggish. That can lead to brain fog. And you mentioned shortness of breath, I believe, or not being able to breathe well. Absolutely. Very good.
All right. What about sudden weight gain? Miss Aileen added.
Word up, Miss Aileen. Yes. And sudden is the key. You can gain weight quickly, and it's not, fat weight, it's not muscle weight, but water weight. And it's amazing because, of course, I see it in my practice. I've seen it over the years when I give patients with congestive heart failure water pills or diuretics like Lasix, furosemide, hydrochlorothiazide, things of that nature, then they can lose pounds and pounds and pounds of weight in one day. And like when they're in the hospital with volume overload and we actually give them intravenous or IV water pills, IV diuretics, we can just sit there and watch them lose 10, 12 pounds of water weight per day. Yes, easily. Mm-hmm. So very good.
We have couple people lose what, say 30 pounds, Dr. Frita?
Mm-hmm. Of water. Yes.
Water.
Yes.
Yeah. Mm-hmm.
Mm-hmm. So that can happen with congestive heart failure. It can happen with kidney failure too. We'll talk about that a little later today.
Okay. All right. Sabrina. Oh, I said that correctly. Weakness.
Absolutely. The weakness, the fatigue. Yes, these can be warning symptoms of congestive heart failure. Good.
All right. I'll do one more from Chris.
Hi, Chris.
Chris says asthma-like symptoms.
Asthma-like symptoms. Yes. Oh, good. So with that fluid in the lungs of pulmonary edema, sometimes you can get wheezing or coughing, and that is a crossover with symptoms of asthma. So yes, wheezing-like symptoms, and you can even cough up a pink frothy sputum or like coughing up a pink phlegm. Yeah, and that can be related to congestive heart failure. Very good. So bottom line, you want to make sure you avoid these risk factors. So try to avoid having high blood pressure, diabetes, or at least make sure you manage them if those are the cards you're dealt. Try to get to a healthy weight to avoid living with obesity when it's interfering with your health. Make sure that you try to maintain a good cholesterol, all those things. And as far as the substance use, like what Ray J is sharing, you certainly want to avoid alcohol overuse and avoid substance use, especially with things like cocaine or things that are going to vasoconstrict. If you suspect that you have congestive heart failure or a low ejection fraction, consult with your doctor, because we do have treatments, we do have managements. And even with Ray J, I'm not his doctor and I don't know for sure, but there is a possibility that with him changing his lifestyle, and they may recommend certain medications like ACE inhibitors, spironolactone, depending on his level, there is a possibility that if you catch it early enough and if you give the proper medications and proper lifestyle modifications, I've watched patients who had ejection fractions in the 20s go up into the 40s sometimes. So there is a possibility. It just depends. It's on a case-by-case basis. So I'm certainly praying that Ray J takes this seriously. I know he's a jokester, telling me he's going to go get some voodoo and hoodoo and all of that, but this has to be scary for him. And I do appreciate him for using his platform to share this medical information. All right. So please go ahead, pause, and give us a like, a subscribe, and a share as we talk about the bat virus. Somebody help me, Shador. Why we got a bat virus? Okay. So I feel like most of us are still in some form of a PTSD, some form of post-traumatic stress from the lockdown, the panini, as some call it, C-19, that virus. And we know that thing spread so quickly. When we first heard about COVID, it was that virus over there, right? It was in China, and it was the mystery Wuhan virus. Next thing you know, global pandemic, everybody is falling out, death rates, never seen anything like it, not in our lifetimes. And now, when I heard about this Nipah virus and that it actually kills up to 75% of the patients it infects, I knew I had to come to you and let you know what's going on. Y'all want to know about Nipah virus? Do y'all want to know if we're going to have another lockdown? Let's play this clip and then I'll tell you some more information.
Officials in the U.S. tonight are monitoring a deadly virus that is spreading overseas. Airports in Southeast Asia are now heightening their airport screenings. Raf Sanchez is following this from London for us. And Raf, what more do we know?
So, Tom, airports across the region are stepping up their screening for what's known as the Nipah virus. This is a far more deadly virus than COVID. It has a fatality rate of between 40 and 75%, according to the World Health Organization. Now, it's usually carried by fruit bats, and human-to-human transmission seems to be rare, but there is no vaccine at this point, which is why these two cases in India are being taken so seriously. The Indian Ministry of Health says it's been doing contact tracing, and it believes the virus is contained. And the CDC says it is monitoring the situation, and it stands ready to assist if needed. Tom.
Okay. To my med heads, I want you to put a bat emoji in the chat. Yeah, they have cute little bat emojis. Put a bat emoji in the chart in the chat and answer this question. Now that you know that they are doing screening at airports in India and Southeast Asia, they're doing screenings. Does that make you feel safe as far as this Nipah virus is concerned? Or are you concerned that perhaps their screenings aren't very effective? So let me know if you're not worried about it, if you feel safe, or if you still have some concerns about this Nipah virus. Okay. So now let's talk about this Nipah virus. It is a very dangerous virus. It is typically spread by fruit bats, and you get it when you eat fruits that have been contaminated by the bats. So like if you eat a piece of fruit that has bat saliva or that has bat urine on it, then you can get this virus. And again, if you become infected with this virus, then there's a 40 to 75% chance that you will die. That's what it is. Those are the statistics. The Nipah virus was first discovered back in 1998 in Malaysia in pigs. It is a zoonotic virus, meaning we typically get it from animals. And so it has been found in pigs. It has been found in horses. And so if you are someone who is a caretaker of pigs, horses, a farmer, it's advised that you not take care of an animal that seems sick without having the proper protective equipment on, okay? Because one thing about it, the Nipah virus, though it's carried by bats, it doesn't make the bats sick, okay? They're flying high, they feel fine, but it can make your pigs sick. It can make your horses sick. And unfortunately, it can make humans sick. If a human comes into contact with Nipah virus, it takes anywhere from 3 to 14 days before you get symptoms. And with this Nipah virus, you'll start off with flu-like symptoms. So maybe fever, muscle aches, fatigue, myalgias. You might even get sore throat. You can get some respiratory symptoms. In fact, some patients with Nipah virus progress to respiratory failure. But really, it's the neurological symptoms. You can get brain swelling or cerebral edema, and you can get encephalitis or an inflammation of the covering of the brain and the spinal cord. You can get seizures, you can go into a coma, and you can pass away. In fact, many people with the Nipah virus will go into a coma within 5 days. It's a deadly virus. And again, it literally kills up to 75% of people. So here's the real story. We know with C-19, okay, with COVID, that joker spread super easily. The good news is that the Nipah virus does not spread as easily as something like the COVID. It doesn't spread as easily as a virus like measles. They are related, but it doesn't spread easily. So when we talk about things like COVID and measles, we know that you can cough, little tiny droplets are in the air. And if you have the measles, you cough, you can leave and go to the grocery store. I hope you don't. And if someone else walks in that room, they can still get the measles up to 2 hours after you've left. Okay. That's how infectious that is. The Nipah virus is not like that. It requires very close contact. So mainly with, something that's been contaminated, a fruit that's been contaminated by a fruit bat, or if you're someone who eats date palm sap, it can be in that. Make sure you boil your date palm sap. I don't know if y'all eat dates or date palm sap, but the thing about the Nipah virus, human to human transmission is possible, exceedingly rare. Okay, it's very difficult. It would take very prolonged contact with a human, like with a nurse. And the two people who have been infected in India are nurses, both 25-year-old nurses, a male and a female. You can also get it if you are taking care of someone with Nipah virus, like if you're a caretaker, but it does require a really close contact. It's not just easily spread through aerosolized particles that hang around. That part is good, because if it were spread like that, we'd have a bigger problem, because again, it can kill up to 75% of the people it infects, 40 to 75%. So if you do get Nipah virus, and I hope that you don't, but if you do get Nipah virus, there's no treatment. Now, there are certain antivirals that are used for other viruses that in an experimental fashion are being used. People will try them, but there's no specific treatment for Nipah virus. There's no licensed vaccine for Nipah virus, just supportive care, okay? Fluids, fever reduction, painkillers, anti-seizure medicines. We don't have a treatment. And so you really don't want to get it. But again, it's not easily spread. All right. So med heads, do you feel good about what we're talking about? Are these sobering thoughts? Am I making it worse? I'm telling you the truth now. I'm giving y'all evidence-based medicine. So who put a bat in the chat? Ooh, who put a bat in the chat? Y'all know
several bats in the chat, Dr. Frita.
Oh, what?
BOK tiger, or maybe black tiger, not sure.
Yeah, that's a black tiger. I know that's right.
Screening will still be a problem, as they will not know if a person has it or not.
Okay, so the screening does not have you necessarily super happy. Okay, so let's talk about it. So we know, of course, they're screening in India. And one thing, let me share this. So I told you that the two nurses were diagnosed with the Nipah virus in December 2025, and right now through January, we know that the man apparently is starting to show signs of recovery. And at least as of this weekend, the woman was still in critical care. I hope she's still doing well. I hope she's still with us, is basically what I'm saying. But anyway, those two people definitely tested and were positive. They found that there were at least 196 people who came into contact with these two healthcare providers. And so they were able to track them. They tested all 196 for Nipah virus. Zero of those 196 tested positive. Okay. So it goes to show that it really does not spread easily. So that's a good sign. And so then now they're also doing screening at airports in India, Singapore, Thailand, Malaysia, Hong Kong. So they're doing screenings there. So to your point, like, how are they going to know? I mentioned that it might take 3 to 14 days before you get symptoms. So what if you come into contact, you are, in India, and you're picking up fruit and you're just biting you an apple, and a bat has been there before you and they licked the apple. You might have come into contact with Nipah virus, but it could take up to 2 weeks before you get a fever, right? Or symptoms. And so to your point, if they're screening you and you have no fever and no symptoms, you might still have it, hop on the airplane, come to the good old US of A, and then 14 days later, now you're showing symptoms of Nipah virus. So screening is all they can do, but I guess it really is not perfect, is it? It's not a perfect science. Anyone else? Who else put a bat in the chat?
Yes, this is from 31 Maisie.
Hi, 31 Maisie.
I still have concerns because it is so new.
It is new. And because we think about it, 1998, I mean, I know that's a minute ago to the good young folks, but that's not a million years ago, is it, for us to have just gotten the virus in 1998? And quite frankly, we don't have a lot of research. And, there have been, since 1998, there have been at least 7 outbreaks in India. And some other countries have had it as well. Malaysia has had it, but the newness, right? It kind of does take you in that sense back to the lockdown that we had here. When the virus is new, when it's novel, then it's hard sometimes to be completely settled. Yeah. What helps to settle me is that it's really hard to transmit, and that of the 196 people who they didn't just screen them, they didn't just check them for fever, they literally tested them for Nipah virus. And all 196 of the people who came to contact with the 2 people who are infected with Nipah virus, they all were negative. And to me, it shows that even though it's new, we are correct about that in knowing that it doesn't spread easily. Now, can viruses mutate? Can they change? Yes, but I don't want to talk about that. Who else put a bat in the chat?
Tim.
Hi, Tim.
Tim says, I feel unsafe because it can survive the environment for 4 days before ever being detected.
The Nipah virus, well, either way, at least from what we know right now with the science, is not something that if it's in the environment is aerosolized easily. But yeah, definitely I want everyone to be cautious on alert. And as we get new information, I'll come here and I will share new information. Yeah. We don't have it in the United States, and reportedly we've never had it, and I would like to keep it that way. But again, with C-19 and with the lockdown, we didn't have it.
Yeah, and Dr. Frita did pose a poll for this question prior to,
you did a poll?
Yeah, I did a poll. How do you feel about having screening measures in place? Safer knowing they are in place, or concerned about the effectiveness? Split down the middle. 50-50.
So some half feel safe, half don't. Yeah, I could see that. But all you could do is control what you can control. One, if you're planning a trip to Thailand or to Southeast Asia, you definitely want to look at local outbreaks, okay, to see what's going on for local outbreaks. And then you also want to be sure that if you're eating fruit, you wash that fruit thoroughly. And if you suspect someone has Nipah virus, which I don't know how you're going to suspect it, but if you do, make sure you keep your distance or wear proper protective equipment. And really, that's all we can do. We can only control so much.
Dr. Frita, there's a question from Deseo.
Hi, Deseo.
Is there incubation period, and will they continue to test them?
Oh, that's a good question. So that incubation period is 3 to 14 days. That's how long it takes before you get symptoms. But now remember, with the people who were in the hospital, so that's how long it takes to get symptoms. That's how long it takes to get symptoms. But even before you develop symptoms, if you have it, then you still will test positive. So these folks, let's see, to my understanding, the healthcare providers, now we know that it looks like back in December of 2025, they were tested. And so it actually looks like of the 196 people with whom they had contact, they were out several days, and it may have been 14 days. And so they do feel very confident that if those people were going to be positive, they would have already been positive. But yeah, 3 to 14 days before you have symptoms, but you can test positive even before you show any symptoms. They outright did blood tests. It wasn't just screening. That's a good question. And are they going to go back and retest them? I don't know. I don't know if they'll wait to see if the 196 people have symptoms. I don't quite know how they track. But in the World Health Organization, if you look up WHO, because that's who's really staying on top of this, World Health Organization, then they'll be able to give updates on their screening and their tracking. That's a really good question.
Absolutely. Thank you.
All right. Shall we play a little game?
What game we playing, Dr. Frita?
Myth versus fact. You know that's my favorite game. Y'all go ahead and give us a like, give us a subscribe, give us a follow. Please, y'all, get on your smartphone, por favor, and look at your WhatsApp, your family group chat, your line sister group chat, your work, your colleague group chat, and put this link in there and let them know that we're here. We're here. Get used to it. We give evidence-based information. Even if they can't watch us right now, they can go back and watch us on replay. Hey, replay crew, I see you. And tell them to go ahead and give us a like, give us a follow. We're giving you evidence-based information. And yeah, that's just what it is. All right. So myth versus fact. Listen, y'all, there's a new syndrome, CKM, cardiovascular kidney metabolic syndrome. And we are learning that many Americans have silent kidney disease. Up to 90% of Americans have silent kidney disease. And so now we are really just coming up with more ways to try to identify it so we can help to prevent some of these negative outcomes like heart disease, like strokes, like kidney failure. So let's see. Shall we play the clip first or do a little myth versus fact first? Let's do myth versus fact first. Why not? Myth versus fact statement number 1.
All right. Statement number 1. Taking statins for high cholesterol is enough to prevent heart disease if you have CKM syndrome.
Okay. Taking statins. So when we're talking about statins, we're talking about things like simvastatin or Zocor, atorvastatin, Lipitor, rosuvastatin. So those are the statins. We know those are cholesterol medications. They also have been shown to help to prevent heart attacks and strokes, cardiovascular disease. Okay. So put an M1 if this is a myth, and F1 if this is a fact. Can statins alone be enough to prevent cardiovascular kidney metabolic syndrome? Pencils down. Myth versus fact statement number 2.
Visceral fat around internal organs is more strongly linked to CKM syndrome and heart disease than overall body weight or BMI.
Okay. So visceral fat. So when we say visceral, we're talking about your visceral organs, like those organs in your stomach and your abdomen. Okay. And so it's having basically belly fat. Is that a bigger predictive situation for heart disease? Or is it just being overall having a big BMI, a high BMI? M2 if it's a myth, F2 if it's a fact. We need some Jeopardy music. All right, pencils down. All right, let's see. What say you med heads? Look, I know y'all are activated. All right, who answered myth versus fact statement number 1, Shador?
Statement 1 again, taking statins for high cholesterol is enough to prevent heart disease if you have CKM syndrome. Then we have a mixture here.
Oh, wow.
So we have Anton. Hey,
welcome back, Anton.
Anton says myth.
Okay, you don't think it's enough. Okay.
Sabrina agrees, a myth.
You think it's a myth. You think there's more to it than simply taking a pill. All right, I hear you.
Our member, Donamichi. Hello.
Hi, Donamichi, RN, Nurse Donamichi, extraordinaire. Now, what she said?
Donamichi says myth, false, probably not enough.
Oh, okay. All right, Donamichi.
Jacqueline says fact.
You think it's a fact. So Jacqueline is like, bump all the rest, all this diet, exercise, and all this other foolishness. If I take a statin, that's enough to keep me from having cardiovascular kidney metabolic syndrome. All right, Jacqueline.
Eyes 1719 agree that it's a fact.
Think it's a fact. Statins are enough. Taking a little Lipitor, Zocor. Okay.
And Ja says it's a fact as well.
You think it's a fact. All right, Ja. Well, this is actually a myth. It's a myth. Now, to your credit, yes, taking statins, we have decades of data. We know that taking statins has a significantly way of reducing your risk from having primary cardiovascular events as far as, preventing heart attacks and strokes. And even after people have had heart attacks and strokes, many cardiologists, neurologists will recommend statins just to help to keep the cholesterol low. And independent of cholesterol, even if you have normal cholesterol, we find that taking the statins can help to reduce your risk. However, it's not enough. So you can't sit around eating every piece of ultra processed food, every piece of fat, every piece of sugar that rolls by you and still expect the statins to be enough. You can't sit around with a completely sedentary lifestyle, just sitting there looking at Bravo, watching Real Housewives of Potomac and Married to Medicine. I'm about to watch those today, but you can't sit around and just watch those and be sedentary, not move your body and think that the statin is enough. So the point is preventing cardiovascular kidney metabolic syndrome is multifactorial. Just one thing won't work. The statins will help. That's true. But you also need to be exercising. According to the American Heart Association, it's recommended that most adults exercise for at least 150 minutes of moderate exercise, 150 per week. So maybe like 30 minutes of moderate exercise per day, 5 days a week. Also, you want to make sure you have a low salt diet. According to the American Heart Association, most adults should have no more than 1,500 milligrams of sodium or salt per day. All of these things will add to decreasing your risk for CKM syndrome. Statins can help, but alone, they don't do the trick. Okay, so that was good. All right. Myth versus fact statement number 2, por favor.
Yes, ma'am. Statement 2. Visceral fat around internal organs is more strongly linked to CKM syndrome and heart disease than overall body weight or BMI.
I'm
All
curious
right.
to see what answers. So
Who's
is
turn?
belly fat or visceral fat, is that more strongly linked to the CKM than just someone who's overall has a high BMI? Now
All
I'm
right.
expecting a mixed bag on this one. If
A
I didn't
little
trick
bit of
y'all
a
on
mixed bag. A little bit of a mixed bag as well.
okay.
All right. I remember Miss Elaine says fat.
All right. Thank you for being a member. All right, Miss Elaine, I see you.
Yolanda says it is a myth.
Hi, Miss Yolanda. Okay, so they're coming out different opinions. All right, this means we can have something to learn.
Angela says a fat.
Okay, so you think having that visceral fat, that fat around a fatty liver, fat around your spleen, fat around your stomach, fat around your intestines, you think that specifically, that fat right there in the belly, you think that gives you a higher risk than just being a heavier person or high BMI altogether. Okay.
Nick Nack says a fat as well.
Nick Nat Patty Wag says the fact. All right, I hear you.
Eyes says a myth.
You think it's a myth. Okay. So you're
And
thinking, okay.
And Sheila says it is a myth.
Oh, Sheila. All right, you say it's a myth. I love it. Y'all are activated. Look, make sure y'all are activated enough to give us a like. Okay, even if y'all are over there multitasking, doing other things, folding clothes, working from on your computer, even if you're over there pretending to listen to a work meeting, but you're watching us, please take the time to go give us a like and a subscribe. All right. So this myth versus fact statement number 2 is a fact. It's a fact. The visceral fat is actually more predictive of cardiovascular kidney metabolic syndrome than just having a high BMI. And let me explain. So when we talk about visceral fat, again, we're talking about the fat in your belly, fat around your organs, like, fat around your liver, fat around your intestines, things of that nature. This fat tends to be, number one, it can let out certain inflammatory substances that can lead to inflammation in your cardiovascular vessels, in your coronary arteries, and even in vessels that, like your cerebral vessels. It can worsen inflammation, and specifically the belly. And that's why even when we are measuring for risk factors, you might have people who do a waist to hip circumference. And if you're someone who has, even if you're not really that big of a person necessarily, or if you don't have a very high BMI, if your belly is considerably larger than your hips, then that alone is going to be predictive of heart disease. Now, how does this relate to someone who has a high BMI? Because I'm sure a lot of you who answered are thinking, well, belly fat is one thing, but if your whole body is, big, and if you have a high BMI of greater than 30, greater than 40, if you have class 3 obesity, that's going to do the trick. But here's the thing. You can be someone who has a high BMI, say you have a BMI of 35, but if you also exercise a lot, if you do eat an anti-inflammatory diet, and if you eat a lot of healthy foods, you might be a person with a high BMI who actually doesn't have much visceral fat. Y'all have seen people who are shaped up like hourglasses and who exercises, and they're what we used to call thick when I was growing up, but they might still have a high BMI. That same person who say is a shapely person who exercises and who eats in a healthy manner, and their BMI just is high, they might actually have lower cardiovascular risk than someone who is relatively skinny, but who has a lot of visceral fat, maybe kind of a big belly, but her BMI is only 23. Okay. So it is possible that you can have a higher BMI than someone, but they have a higher risk if they have more fat around their visceral organs. So that's something that's important to know. And for those of you who, are skinny, or some people will even call you skinny fat, if you're not exercising, if you're not eating an anti-inflammatory diet, and you just happen to have a lot of fat around your visceral organs, please don't relax. You can actually be at higher risk for CKM, cardiovascular kidney metabolic syndrome, than the person who is living with obesity. Yeah, that was an important question. So yeah, visceral fat or belly fat specifically puts you at high risk. All right. But again, this cardiovascular kidney metabolic syndrome, honey, is relatively new, but basically it's just pointing out that heart risk factors, kidney risk factors, and then living with obesity and diabetes mellitus type 2. That's the metabolic part. And there are different stages of it. There are different classes of, all the way starting at stage 0. And so talk with your doctor and mention this CKM. I'll probably do a short on this because it is relatively a new concept. All right. But thank y'all for participating in my little game, and it's not over. There's more to come because we're about to get into more trending health topics. Okay. We're going to get into the trending medical headlines and celebrity health news even more. Speaking of celebrity health, Quinton Aaron, please put a football in the chat. If you ever, no, don't put football. Wait. Please put some eyeballs in the chat. Eyeballs in the chat. If you remember the movie Blindside. Okay. And what the family, I guess, essentially adopted a white family essentially adopted an already pretty big guy, teenager going to college, very, very big Black man, excellent at football. And, they adopted him. And the story gets a little controversial in the aftermath when we hear kind of what happened with the money. But the actual movie itself, we'll just keep it there, was actually very heartwarming to some. Not so heartwarming to some cynics like me. But anyway, that star, Quinton Aaron, has had some very serious medical conditions. He had something called a spinal stroke. So let's play this clip and let's talk about this rather rare type of stroke.
This morning, the Blindside star Quinton Aaron is fighting for his life after collapsing in his home. According to TMZ, Aaron was walking up the stairs in his Atlanta apartment last week when he suddenly lost control of his legs and fell. A GoFundMe page for the actor claims he was quickly rushed to the hospital where he is currently on life support with a severe blood infection.
We could be dealing with two issues here. One, the blood infection, and then two, potentially a secondary trauma that could have serious consequences.
ABC News has not yet learned the cause of the collapse, but his former manager told us the actor has made some progress.
I can tell you that things are looking more positive today than they were yesterday. He was mobile, and we're just praying and hoping for the best right now.
What?
Never had one before.
What, a room to yourself?
A bed.
The 40-year-old actor gained global recognition, starring alongside Sandra Bullock in the Oscar-winning sports biopic portraying former NFL star Michael Orr.
Yeah. Did anybody see Blindside? I know y'all saw Blindside. Who saw it, Shadora?
Yes, Dr. Frita. I know I've seen it. Quite a few.
I put some eyeballs in my chat.
Miss Aldrika, hey, she's seen Blindside.
Hi.
Chris with a K has seen it.
Hi, Chris.
Sherry says she's seen Blindside.
Yeah. It's been a minute since that movie came out.
Mhm.
But yeah, so what he had was a spinal stroke. So I'll explain spinal stroke to you, but I do want you to put a football emoji in the chat and tell me, before Quinton Aaron's story, had you ever heard of a spinal stroke? Before Quinton Aaron's story, had you ever heard of a spinal stroke? And I guess if a lot of people put no, then I probably will go and put out some more information about it. So basically, a spinal stroke is when you get a decrease of blood flow to a section of the spine, and some call it, spinal infarct. And basically, of all the strokes that you can have, spinal strokes only account for 1%. So of strokes, spinal strokes are pretty rare. The most common cause of a spinal stroke would actually be a blockage of blood flow to a portion of the spine, okay? Like an ischemic event for a portion of the spine. There are some cases, though, where you can get hemorrhagic strokes, like extra bleeding, like excessive bleeding. The same as you can get ischemic strokes in the brain, or you can get hemorrhagic strokes. The ischemic strokes in the brain were common. About 85% of the time they're ischemic. As far as bleeding or hemorrhagic strokes in the brain, about 15% plus or minus. So for the spinal stroke, it is pretty scary because some of the symptoms include paralysis. Okay, that can be a symptom. or also you can get some pain, numbness, tingling in the hands, arm, pain, numbness, tingling in the legs and the feet. You can have urinary incontinence. Okay, you're no longer able to control your urine. You can have bowel incontinence. Okay, having bowel movements on yourself. You can get tingling or a loss of sensation in your perineum, in the area that you sit on, the area of your body that would cover a saddle. If you were sitting on a horse saddle, you can lose sensation there. And so as far as recovery, if someone finds out that you've had a hemorrhagic, spinal stroke, then of course they're going to try to stop the bleeding. If they find out that you've had a spinal stroke that's due to ischemia or due to a blockage, that they might actually give you some strong blood thinner. So it really just depends. The treatment depends on what kind of spinal stroke that you have. But again, it's pretty rare. It's only 1% of all the strokes that happen. But if you get it, it can be quite devastating. And unfortunately, Quinton Aaron has it. The risk factors are pretty similar to the risk factors for any stroke. So age over 65, high blood pressure, high cholesterol, being someone who's living with obesity. These are just some of the risk factors for a spinal stroke. But yeah, it's a real thing. We don't hear about it much. We don't talk about it much because it is so rare. But I guess anything is rare until it happens to you, because once it happens to you, then you had 100% chance of getting it. All right. Did anybody put a football emoji and say whether or not they had heard of spinal stroke before? Quinton Aaron's story?
Majority of everyone who's coming is saying no, never heard of it before.
Okay.
One person, Jetty, hi. She says, yes, Michael on Dothan and Charm had a spinal stroke.
Oh, what show?
Dothan and Charm, Southern Charm, maybe. I think it might be a typo.
Oh, Southern Charm. That's that Bravo reality show. Oh, wow.
With Michael on that show
Okay.
had a spinal stroke.
Very good.
Other than that, majority are saying no, never heard of it before. I never heard of it before, certainly.
Yeah, it's rare. So I think I'll do a piece. Of course, Big Brain Jetty heard of it. But yeah, so okay. So I'm glad. Thank y'all for being honest. For most of you who hadn't heard of it, because that always helps me to know which way I need to go with the evidence-based information I share. So so we have a point of a knowledge need with spinal stroke. Very good. All right. Give us a like. Give us a subscribe. Keep going. Let's keep going. And let's talk about my specialty, kidney disease, because Octavia Spencer and Sofía Vergara have teamed up to give some information about ways that kidney disease has touched their lives specifically. And so we'll talk about kidney disease right here. So let's play the clip and let's talk about kidney disease.
A world where people may miss a warning signal from their body. One woman.
Hello?
Okay, 2 women are spreading the word.
People with high blood pressure or type 2 diabetes.
Like my mom and you, Chica. Our kidneys could be sending out an SOS about increased risk like heart attack or stroke. Don't miss the signal. Ask your doctor about a simple urine test called UACR and join our mission.
I just got my permit!
You know what? They're so crazy. I love it. They're talking about something serious, but they still are being light. That Sofía Vergara will crack me up every time. But yeah, they both have different relationships to kidney disease. But I like that they're teaming up in that they are sharing. So basically, with Octavia Spencer, we know that she's been open, that she's living with diabetes mellitus type 2 with high blood pressure. And the top 2 causes of kidney disease are number 1, diabetes, which she has. Number 2, high blood pressure. Now, with Sofía, I don't believe that she has any of these, but she's been a caretaker to her mother, who is at least living with high blood pressure. And so they're coming out and they're sharing and they're talking about the awareness, and they're spreading information on what are some things that can be done in order to help to pick up or screen for kidney disease. Which, incidentally, let me just ask y'all, med heads. Let me ask y'all, put a kidney in the chat, and I want you to tell me what kinds of tests. And this is this is not an obvious answer. This is going to require seeing what y'all know. Yeah, y'all want to come up here and be big brains all the time. Let's see if y'all know this. Med heads, I want you to put kidney in the chat, and I want you to tell me some screening tests that might let you know that you have kidney disease. Some tests that you can ask your doctor about, or that your doctor might volunteer. What are some screening tests that might let you know that you have kidney disease.
Mm-hmm.
Yeah. What
Yeah.
y'all got?
Sabrina already put up answer before you posed the question.
Oh.
Sabrina on Facebook.
Hey, Sabrina on Facebook.
UACR.
You didn't even let me get my question out good. You come up here to the front of the class. Jeez, come on from a Facebook and come over to the class. Absolutely, UACR. So that's the urine albumin to creatinine ratio. Okay, so albumin is a type of protein, and normally your kidneys should not let you leak any albumin into them. Okay, so you should not have that protein in your urine. If you are leaking protein or albumin in the urine, this can be an early warning sign that you have kidney disease, because the way that the kidneys are set up, so most of us are born with two kidneys. Okay, there are some congenital differences. Most of us are born with two kidneys, and we have these glomeruli, these little kidney cell sets, okay, kidney functioning units. And albumin is a protein that has a negative charge. Well, guess what? So do these kidney units. Each glomerulus, your glomeruli have negative charge. And you will remember from Science 101 that negative repels negative, right? So just a charge alone, if your kidneys are working the way that they should keep the albumin from seeping through the filter. The other thing is that the filter should be tight enough. Okay, the slits should be narrow, not wide. If the slits are narrow in your kidney filter, they shouldn't let the big old albumin, that protein, come through. Okay, so we got a charge just keeping them from coming through with normal functioning kidneys, and we've got nice tight slits in the filter of a normal kidney. Well, if we test your urine albumin to creatinine ratio and we see that you have a bunch of albumin or protein in there, then the kidneys have done us wrong. Okay, that means that something is wrong with the anatomy of your kidney, and that's a warning sign that the barrier has been broken. Albumin is leaking through, and so it's time to find out why and what we can do to treat it. So with the urine albumin to creatinine ratio, if it's less than 30, that's considered to be within normal limits. But the higher it is, the more abnormal it is, and the more of a red flag to your kidney doctor. And so, yeah, come on to the front of the class. So, Sabrina, come on to the front of the class, yes, because the urine albumin to creatinine ratio, not every doctor will do that, but your primary care doctor can do that. And so if it's not something that they volunteer, when you go in, just ask them. Say, hey, can we do a urine albumin to creatinine? Can we do a UACR? I just want to, know if I have any early signs of kidney disease, because guess what? Even if your blood work is normal, you can still have a high UACR. It can pick up kidney disease even earlier than some other screening tests. So that was a very important one. Mm-hmm. Anyone else?
Yeah, we Dr. Frita had a patient, concierge. She was asking about the UACR. Her insurance actually offered her. They were going to send her a test kit to do it. So she was, trying to figure out, do it with you or do it with her insurance. But so some insurances even offer that test. They'll send out a kit, I guess, for the urine sample to have it done.
Okay, so we can let her know. She can go ahead and do it with the insurance kit, and I can help her to interpret the results, especially if she gets an abnormal result, then I can help her as far as which way we go. Okay, very good. And for anyone else who wants to come like she did for concierge, make sure you click the link in my description or go to the one-stop shop, drfrita.com. For the telehealth concierge, I can help you from anywhere in the world. I am all the way live, all the way animated. As I shared earlier, I have been quadruple board certified in nephrology, internal medicine, pediatrics, obesity medicine. I love to learn a lot about a lot, and I especially love to share my information. So I'm telling you, come on to do a concierge appointment. You won't be disappointed.
Absolutely.
Okay.
Dr. Frita, a popular answer here, creatinine.
Absolutely. That's very good. Creatinine. And that's one of the blood tests. And this is a typical test that your primary care doctor will do on your routine visit. The lower, the better for the creatinine. It's a marker. And so if your kidneys are getting rid of creatinine, then we know that they're likely getting rid of other kidney toxins. Now, I will say for the creatinine, it's also a byproduct of muscle. And so if you're someone who has more muscle mass than the average person, your gender and your age, you might have a higher creatinine because you're muscular, and that could give you a falsely low kidney function. So the creatinine is one of our screening tools. It is not perfect, but it's something that we're able to pick up. Good.
Yeah. And along with creatinine, EGFR.
Absolutely.
And a lot of people are saying the EGFR with the creatinine and BUN.
Absolutely. You got it. Y'all got it. Everybody come on. Let me scoot over so y'all come to the front of the class. So yes, so the BUN, creatinine, EGFR. That EGFR, the estimated glomerular filtration rate, that's really the one that we use when we're trying to establish what level of CKD you have, if you have it. You'll recall there are 5 stages of 1 is the best, 5 is when you're eligible for dialysis or a transplant. It's that EGFR that helps us to measure where you are. For example, if your EGFR is 90 or higher, you have CKD1. It's actually normal if it's 90 or higher, but if you have something going on with your anatomy or protein in the urine, we'll label you CKD1. If your EGFR is less than 60, that's when it's going to light up as abnormal on your labs, okay? So if your EGFR is between 30 and 59, then you have CKD3 if it's been there for 3 months or more. And if you have CKD3, then it is standard of care for you to be referred to a kidney doctor like me, to a nephrologist. And then jump. If your kidney disease progresses to where your EGFR is less than 15, that's the final stage, okay? That's when you're eligible for dialysis or a transplant, that's CKD5. I will say this, just because your EGFR does hit below 15, it doesn't automatically mean that it's time to go on dialysis today. Make sure you consult with your doctor because there are many things that we can do to help to keep you off of dialysis for as long as we can, especially if we're trying to bridge that gap and get you to have a transplant. But we don't recommend that you do it alone. Consult with your kidney doctor. And check out my video right here on YouTube, CKD Stages Explained. I go into a lot of detail to help to educate the people, just like Octavia Spencer and Sofía Vergara are trying to educate the people. I really appreciate them for that. And I appreciate you medheads for all of your participation. I do have one more question on my way out the door. Is there a door emoji? I don't know. Now I'm tripping. But I just want to ask y'all this. Do put door, D-O-O-R, or put a door emoji. I want to ask you this. What is it that motivates you to go and get preventive health or to take care of yourself? What is it that motivates you? Is it your family? Is it seeing when celebrities share news? Like, what motivates you? Is it just something internal because you want to live here and have a good quality of life? What motivates you to get preventive care and to take care of yourself? And while y'all are putting that in the chat, I want to say thank you. Thank you, because again, we are well over 950,000 subscribers right here on YouTube, on our way to 1 million. So again, if you haven't done so already, please make sure that you subscribe and that you share and that you give us a like. And for the videos, honey, I have hundreds of videos at this point, and I give you evidence-based information in a way that's easy to understand. I also share short form content here and on other platforms. Just yesterday, I have a short form video. It's about 3 minutes on Nipah virus. And so you'll be able to share that with other people when you look at your YouTube shorts, and so they can have a good understanding. I do videos on recalls. I'll probably do a video today on another. We have so many recalls. Did y'all see the video I did on that tuna recall? I know y'all over there eating tuna sandwiches. I hope y'all saw the video before you take a bite in your tuna salad or your tuna sandwich or your tuna casserole. Anyway, but I do those short form content. I did a video on Ray J where I know I explained it a lot here, but I have nice little short, easy bites that are easy to understand and pretty complete, really, as far as information that you can share with loved ones. So make sure you check me out there. Oh, I also let you know when I'm going to be on national news shows. When I know, sometimes I don't get a warning. They'll just call me with breaking news. But just on this past Friday, I know that those of you who've been following me for a while, that I've been on the Don Lemon Show several times. Okay, I'm a friend of the show. And you've heard that he was arrested after he was covering a Minnesota protest in a church. And so while he was in jail, there was a big live stream without him with different friends of the show. And so I was on that on this past Friday. And so I did put a short form information, a short form clip of me being on there. And Katie Fang was interviewing me. Reese Colbert was on there. Joy Ann Reed was on there. Anthony Scaramucci, just a whole slew of friends of Don Lemon were on there talking about freedom of speech, freedom of the press. Because regardless of your politics, whether you are right, left, independent, or in the middle, wherever you are, one thing I hope that we can agree on is that it's important to protect constitutional rights, including freedom of speech, freedom of assembly, freedom of the press. And so you can check out my short form content. And what I'll do is when you go right here on YouTube my playlist, I have TV appearances. I'll try to put up something where I show you where I was actually on his live stream. Yeah, they did it for hours. I came on at 4 hours, and there was the one that was on just this past Friday. Anyway, now I said all that, but just make sure you like, make sure you subscribe, make sure you buy my book, Under Pressure, Guide to Controlling High Blood Pressure. And on the way out the door, Shador, did anyone share what helps to motivate them to stay healthy? We'll just do a few, maybe see what the members are talking about, and then we'll head on out.
Absolutely, Dr. Frita. Plenty to say. Second here. Lady Normal. Or Lady
Normal.
Complete my purpose and for my family.
I like
family
that.
is a big one. Family is a big one, Dr. Frita.
Family is a big one. I bet that it is. But I also like how you said complete my purpose, because sometimes I think, especially if you are a mother, you can sometimes get lost in your kids. And I guess it's the way we're wired. They make us just about bananas for our kids, so we're able to protect them and nurture them. But you also don't want to, you want to make sure that you don't lose yourself. Okay. So I like that you said protect your purpose and your family. I like that. Lady Normal.
Remember Miss Elaine.
Hi, Miss Elaine.
Would like to have a better quality of life.
Quality. So it's not just about living a long life, right? You want to enjoy your life, be able to move your body, bend, drop low, travel, have a good quality. So I like that. Yeah.
Absolutely. And then Sheree, we haven't heard from you much today.
Hey, Sheree.
Sheree says desire to be healthy and to catch things before they get out of control. Love my family.
Preventive care. So yes. And again, family, like what you said. Yeah. But preventing it instead of waiting, which sometimes is scary, right, Sheree? Because you go to the doctor, you might be feeling good, looking good, and here they go. Well, your cholesterol, or looks like, you know, your hemoglobin A1C, or it's time for a mammogram. You don't want to hear it. Look, I don't be wanting to hear it. And so it's scary when you already feel good and you go to the doctor because you don't want to hear any bad news. But what you really don't want is to ignore that news that's there early on that you can catch before it goes to something else. So I agree with you, Sheree. Go to that doctor and get the preventive care so that you can be around for yourself and for your family. Good.
Yep, absolutely. Thank you, Dr. Frita. Dr. Frita, I have a question from someone.
Okay.
So I think they may need an answer rather sooner than later. This is from Willie.
Hi, Willie.
Willie says, I am on dialysis. I have severe cramps, muscles and spasms. What am I doing wrong?
Oh, you're not doing anything wrong, Willie. Mr. Willie. Or is it's, you know what? Can we tell?
This is Mr. Willie.
Okay, because you're not got, we have people named Willie also. All right, Mr. Willie. Yeah, no, you're not doing anything wrong, but let me talk to you about the cramping because it's actually something that we see very common. So of course, when we go into dialysis, when we do the dialysis, the hemodialysis, blood dialysis, we are running your blood through the filter, right? The dialysis machine, and we're pulling out any excess fluid because for many people who have gotten to the point where the kidneys aren't working well, you might not make as much urine as you used to, which can lead to excess fluid in your body, excess fluid in your lungs. So when you're on the dialysis machine, we pull the fluid out. Well, if you say have gained a lot of weight, like a lot of water weight, then sometimes we're pulling off the fluid pretty fast, right? Pretty rapidly. And if we pull it off too rapidly, that can cause you to cramp as your body's, fluid shifts. Okay. So that doesn't mean that you're necessarily doing that, but I would make sure you do a checks and balances with yourself. Talk to your kidney doctor and talk to the dietitian. Find out how much water you're supposed to be gaining. And if you're gaining a lot, especially like over the weekend, if you're gaining more than 3 liters of fluid, for example, like more than 6 pounds of fluid, then you want to make sure that you do a fluid restriction and that you don't drink too much fluid, because the more fluid you put on, the more we have to pull off. And if we pull it off too quickly, that can make you cramp. Okay. So that's just one thing. The other thing is that sometimes if we are pulling too much fluid, like say, for example, you have gained weight, like real weight, like muscle weight or like fat weight, we might have you, for example, at, we might say that we're trying to get you down to 80 kilograms. I'm just picking a number. So I'll just say, okay, say we're trying to get you down to 80 kilograms, but over time you've been eating better, feeling good. Maybe you've gained up to 82 kilograms. If we still try to get you down to that same 80 kilograms that was fine for you when we met you, then we're going to make you cramp. So then what you need to do, please, is talk to your kidney doctor and also talk to your charge nurse and say, hey, let's look at my dry weight. Maybe I've gained some weight and y'all are pulling too much fluid off. So bottom line, cramping is something that does happen pretty frequently. It's usually related to the fluid, either it being pulled too fast, which could be from, you gaining or drinking too much sweet tea and lemonade over the weekends, or we might need to readjust your dry weight. We might be pulling too much fluid from you, and you may have gained weight since we last assessed it, gained real weight. So just talk to your doctor, and hopefully, we'll be able to, your doctors will be able to stop the cramps. Because I know when my patients get cramps, it's not just a little bit of a Charlie horse. It's more than just a notion. Tell me if I'm telling the truth, Mr. Willie. My patients are miserable, and it's so hard to get those cramps out. We usually give them a little bit more fluid back on the machine. Some of them, I don't know the evidence behind this, will eat mustard packets. Okay. Look, I'm not saying that's, y'all know, I'm not saying that's evidence-based medicine, but I'm just saying anecdotally, some of my patients will take mustard packets, put those on their tongue, and it helps. I don't have evidence to support it, but maybe I'll look and see if I can find some. But yeah, let your kidney doctor know, let your charge nurse know, and good luck to you, Mr. Willie. And thank you for being here. Yeah. And for those of you listening and you don't know what Mr. Willie and I were talking about as far as dialysis, right here on the YouTube channel, I do have videos with dialysis information. I have one on hemodialysis and also have one on peritoneal dialysis, the home dialysis, just to give you an idea of the options when it comes to dialysis. All right. Well, thank y'all. We're going to slide to the left. I appreciate y'all for being here. We covered quite a bit. Make sure, again, you give us a like, you give us a subscribe, you follow me on all social media platforms, because on different platforms, I might give you a warning if I'm going to be on national news shows. And sometimes I'll just post what's going on in my life. I usually try to relate it back to medicine, but sometimes I just be having an attitude and I hop on social media and just act out. But mostly I give evidence-based information on all channels, and I love to share. And I really appreciate you all for all of your participation. Again, go to drfrita.com. That's my one-stop shop. You can find out my favorite blood pressure cuffs, my favorite juicer. I have a discount code for you. And hey, we just got a whole lot of information. We got it all going on. Give us a subscribe. Help us get to 1 million. I'll see you next week. Okay, next Monday, same bat time, same bat place, where we'll give you more of the latest trending medical headlines and celebrity health news. I appreciate you for being here. I'm Dr. Frita. Thank you for making Monday your healthiest day of the week.